हाय नमस्कार डियर स्टूडेंट्स। आज हम यही सीरीज में कार्डियोवैस्कुलर के ड्रग्स के डिटेल्स में वी आर गोइंग टू कवर टुडे कैल्शियम चैनल ब्लॉकर्स. So calcium channel blockers are considered one of the most important class of medication for the hypertension management, angina, heart failure and arrhythmia. These medications are considered as the most commonly prescribed medications. That's why you can expect the questions from the calcium channel blockers are more likely in your global pharmacist licensing examinations like PBC, OPRA, FPG, KPS, PSI, all these exams, you can expect to get the questions from the calcium channel blockers. So without delay, we jump into the calcium channel blocker class, and you can learn individual medications much in a detailed format, and you are capable to handle various different questions from the calcium channel blockers. So let's jump into it. Okay, so we consider the calcium channel blockers broadly. Like when we start preparing for the calcium channel blockers, we have to divide the medications with their chemical structures. So broadly, there are three different group of medications are considered as a calcium channel blockers. One is the dihydropyridines. So when we are talking about the dihydropyridines, you can remember amlodipine, felodipine, lercanidipine, nifedipine, and nimodipine. That means all the dipines. These dipines are considered as a dihydropyridine group. Okay, so this medication has a different user case compared to this two class. Okay, benzothiazepine, that is a diltiazem. And third is phenylalkylamine, that's a verapamil. Okay, so broadly we can divide these medications in this way. This is the one different medication, this is the second different medications. Verapamil has a different user case, and dihydropyridines has a different user case. These dihydropyridines are mainly act on the blood vessels. Okay, so at this point of time, you have to just remember the basic things, and then we are going to top up and add on all the more specific information into it. And at the end, you are going to become the competent enough to handle all the questions related to calcium channel blockers. When the verapamil is mainly act on the myocardium. So this is the big difference between these two different class of medications. When we are talking about the diltiazem, that has mixed kind of effect. That's act on the blood vessels as well as the myocardium. So these are the two different ways of the classifications. One is the chemical structure based classification, and the second is a physiologically, or that's the accent based classifications. Okay, so you have to remember these two different kind of classifications to get the more detailed understanding about the calcium channel blockers. Okay, we jump deeper into it. Mode of actions. Mainly, the name itself indicating the calcium channel blockers are mainly block the calcium channels. That means the calcium inward flow is blocking. So what is the primary role of calcium? Calcium is responsible for maintaining the contraction and the positive electric current production. Okay, that means the calcium is responsible for contraction, and this contraction is responsible for vasoconstriction, that is responsible for increase the electric conduction process, that increase the release of neurotransmitters and hormones, that is maintaining the muscles contraction. All these functions are mediated through the inward flow of calcium. So when we are blocking the calcium inward flow, we are expecting to get the opposite actions like vasodilation, muscle relaxation. Okay, so this kind of effect, and also the electric current is slowed down. This kind of actions we can expect based on the blocking the calcium inward flow. Okay, so second important point that you have to understand is where it works. So vascular smooth muscles, myocardium, and also this act on the cardiac conducting system. Smooth muscles of heart, blood vessels, and conducting systems. These are the three main locations where the calcium channels are primarily function. And which type of calcium channel is blocked? L-type calcium channel is blocking by these medications. Okay. So what kind of effect we can expect? So chemical structure and site of action based the therapeutic effect we can expect is dihydropyridines. Dihydropyridines mainly act on the vascular smooth muscles. That means that is decreasing the peripheral vascular resistance. So these medications has a main action is reducing the blood pressure because they are vasoconstriction is going to be minimized and the vasodilation is the primary effect that we can expect with the dihydropyridine group of medications. Minimum myocardial effect. Okay, this is the very unique user case of the nimodipine. Nimodipine, that is a dilate cerebral blood vessels. Okay, cerebral vessels increase the blood flow and prevent the cerebral ischemia post subarachnoid hemorrhage. That means if the patient is suffering from the stroke or the hemorrhagic stroke, in that situation, initially what happened, the blood vessels is leak and the blood is coming out from the blood vessels. That means the bleeding is occurred. When the bleeding is occurred, due to this bleeding, this response to these blood vessels is spasm. That's the spasmodic condition is happening. That means the major brain blood vessels are start getting constricted and spasmodic. Okay, so in that situation, what we required is we need these blood vessels in a dilated form. That is only possible if we are giving the certain kind of medications that mainly and targetedly focus on the cerebral blood vessels. So this is a very unique user case of the nimodipine, and you can expect this very unique question in your examination. What is the primary use of nimodipine in the patients? Okay, or you can get the questions like this: which of the following calcium channel blocker is used for the patient, those who are suffering from subarachnoid hemorrhage? Okay, so prevention of the cerebral ischemia if the patient is suffering from this kind of hemorrhagic stroke situation. This is very, very, very important question for your examination. So you understand the two different stages. One is you don't have to get confused about the hemorrhagic. Normally what happens when the hemorrhagic stroke, we should not have to give the medications that are the vasodilatory. But in this situation, if the patient is suffering from the hemorrhagic situation, the post-hemorrhagic reaction in the blood vessels is a vasospasm, because the body is trying to prevent the bleeding and they are trying to control the hemorrhage. Okay, in that situation, the overspasmodic situations, when the overspasmodic situations occur, the vital part of your brain is not getting enough oxygenated blood. In that situation, that can cause the ischemia. Okay, so this ischemia can be minimized by the medication that can cause the vasodilation. And that's why the nimodipine is the most important medication used for prevention of the cerebral ischemia in the patient with the post-hemorrhagic stroke. Perfect. Verapamil. Verapamil has a main effect on the cardiac muscles, that's the myocardial, decrease the contraction, decrease the contractility of the blood, of your myocardial muscles. And that's why verapamil is mainly used for the reduction of the heart rate, and that has a weaker effect on the vascular. So verapamil has a main effect on your myocardial muscles. And that's why this medication is used for the angina and kind of disease conditions. Diltiazem has the mixed kind of effect on the cardiac as well as the vascular smooth muscles. Okay. diltiazem is lesser effective on the myocardium compared to the verapamil. So this is the good comparative understanding. So far what we have understood the classification based on the chemical structure, classification based on the site actions, and due to the site of actions we have classified the medication into mainly two groups. One is the medication act primarily on the myocardium, other one is on the vascular, and one is in between. Okay, that's perfect. Let's we move to the next part, that is the indication. Mainly the calcium channel blockers are used for hypertension and angina. Hypertension and angina, these are the conditions where the calcium channel blockers are used. Contraindication in cardiogenic shock. Why this medication is not used in cardiogenic shock? Because in cardiogenic shock already vasodilation is there. Due to this vasodilation, the cardiac contraction has been reduced. That means this is the severe bradycardia due to widespread vasodilation. Okay, so if we are giving the calcium channel blockers, either that medication can cause further vasodilation, and also that's to slow down the heartbeats. So in that situation, we should not have to give the medication that can worsen the cardiogenic shock. That's why the calcium channel blockers should be avoided in the patient, those who are suffering from cardiogenic shock. This is also important question in your examination. Coexisting condition, we have to be careful about it. Okay, what kind of careful we have to be? Like in heart failure patient already ejection fraction is low, heart is not pumping properly. If we are giving the medication, that medication is further slow down the cardiac contraction, and that can worsen the situation. Okay, so impaired the left ventricular function, risk of worsening the functions, and the highest with the verapamil, because the verapamil is significantly act on your myocardium muscles. Then the second level is a diltiazem, and the lowest possibility of the heart failure related the complications is associated with the dihydropyridines. That means like nifedipine groups. Okay, angina may worsen initially with the dihydropyridines. Okay, this is very important point you have to keep in mind. Okay, and also you have to understand the word by word. May worsen the initially with the dihydropyridines due to the reflex tachycardia. Okay, now try to understand this situation. This is your heart, this is your blood vessels. Okay, so the blood vessels has it, this is the diameter of your blood vessels, and the heart is pumping in a proper in the normal way. Like when we are giving the calcium channel blockers like a dihydropyridines, that can cause the vasodilation. This vasodilation is increase the vascular diameter. In that means what happened, the blood pressure is significantly dropped down. Blood pressure is significantly dropped down, that reduce the cardiac resistance. That means now heart is feeling more freedom, and this more freedom that increase the pumping capacity. That's called the tachycardia. Okay, that's the tachycardia. This tachycardia is because of this extension of the vasodilation. That's why this is called the reflective tachycardia. Why this reflection has happened? This reflection is happened because of the vasodilatory effect of the dihydropyridines. That means what? If this tachycardia happen, that increase the oxygen demand of your myocardium, that increase the oxygen demand of myocardium, that means that worse the symptoms of angina. Okay, that's why we have to be very careful about it. That's the verapamil is a choice of drug for the angina, but when the dihydropyridine type of medications are given, initially the increase the heartbeat, that increase the oxygen demand of myocardium, and that can worsen the symptoms of the angina. That is the very, very important point that you have to keep in mind. Aortic stenosis, that means aortic stenosis, the blood peripheral blood vessels related the problems, specifically the blockage in aortics, this dihydropyridines that can worsen the hypotension, and that's decrease, the coronary hypoperfusions. This kind of situations get worse, and that's why we have to be very careful about coexisting conditions. Hepatic impairment, dose reduction is required. Elderly patients start with the lowest possible dose. The pregnancy, this is also very important. This point is very important. Nifedipine is used for threatened preterm labor. Okay, preterm labor. What is the meaning of preterm labor? In a severe situation where the pregnant woman is getting the excessive contraction of the uterus. Okay, excessive contraction of the uterus in a preterm form. Like for example, it's supposed to be after 9 months, but the preterm over stimulations of the uterus. In that situation, we need to relax this uterus. This uterus is also the smooth muscles, so the calcium inflow reduce with the help of nifedipine that can make the uterus more relaxed, and the uterus is become more relaxed. In that situation, this labor pain will be resolved, and also we can delay the preterm labor, and the fetus is getting more opportunity to grow inside the womb. That is very, very important point. So this is the unique user case of the nifedipine. Likewise, we have understand the unique user case of which medications. One is the nifedipine is used for preterm labor management, and this medication like nimodipine, that's used for prevention of the cerebral ischemic stroke after the patient, those who have subarachnoid hemorrhage. Okay, so these are the points that you have to keep in mind, and you have to learn these two different and the unique user case of the medications. Done. Let's move to other part. The breastfeeding, normally nifedipine, diltiazem, verapamil, nifedipine is considered as a safe, and always, like in breastfeeding situations, we have to consider the medications based upon the weightage. Okay, the benefits and the side effect related weightage. Okay, adverse effect, peripheral edema. Mainly this peripheral edema is a pedal edema. Okay, so your feet is getting more edematous because of these calcium channel blockers that block the calcium inward flow. Due to that, the vasodilation happen. When we are talking about the vasodilation, mainly at the terminal parts where the single epithelial cell blood vessels are getting dilated. In that dilation, the gap between the endothelial cells is increased, and that increase the permeability of the fluid. So the fluid is getting moving outside of the blood vessels, and due to that, that can cause the edema. So mainly gravity, pressure, and all these things occur at your lower body, mainly at your feet. That's why that's called the pedal edema, is the side effect associated with the calcium channel blocker. So you have to keep in mind about this point. This is a very, very important point to understand. And the second most important thing is calcium channel blocker induced edema should not be treated with the diuretics, because normally the edema is due to the fluid retention. Okay, in that situation, excessive fluid need to be thrown out from the body. But when we are giving the calcium channel blockers, that's due to the vasodilation and the increase the permeability, and due to that the edematous condition has occurred. So if we are giving the diuretics, that increase the risk of hypovolemia. Okay, dehydration and hypovolemia, because the volume or the fluid extension hasn't happened. That is a very, very important point. Calcium channel blocker induced edema should not be treated with the diuretics. Okay, rest is associated with the allergic reaction. Okay, headache, Why headache? Because the vasodilation that change the blood pressure, increase the blood flow in your brain, and that might can cause the headache. Fatigue, dizziness. Fatigue and dizziness. Dizziness is also again the blood pressure change. Pretty much all the antihypertensive medications can cause the dizziness. Fatigue is another the common problem associated with when we start with the blood pressure reducing medications. Flushing, the flushing is again the vasodilation that increase the blood flow. Okay, and due to that we are feeling the more flustered, like the blood is rushed to your blood vessels. Okay, nausea, abdominal pain, these are the problems associated with calcium channel blockers. Gingival hyperplasia, your gums are getting bigger. Bradycardia, the bradycardia is mainly with the diltiazem and verapamil because that's a directly act on your myocardial muscles. But when we are talking about the nifedipine, that can cause a tachycardia because the vasodilation and reflective tachycardia is associated with the nifedipine. That point is a distinguish and the difference between these two medications. Constipation is the problem associated with verapamil. Okay, infrequent pulmonary edema, hypotension, tachycardia, chest pain, that is also self-explanatory because the vasodilation that can cause the pulmonary edema. Hypotension is the blood vessels dilation related, tachycardia is the reflective tachycardia. Due to this reflective tachycardia, increase the oxygen demand, and due to that might the patient get chest pain. Dyspepsia, constipation, and paresthesia, these kind of side effects are also there. Muscle cramp, polyuria, rash. Diltiazem can cause the atrioventricular block, and the verapamil can increase the hepatic enzyme elevation. Okay, Parkinson related problems, dihydropyridines increase the cerebral and myocardial ischemia. Because what? Significantly drop down the blood pressure, and that doesn't maintain the blood flow, and due to that cerebral ischemia can occur. Diltiazem can cause Steven-Johnson syndrome. Steven-Johnson syndrome, that's the allergic reaction or the skin edematous condition, inflammation, that kind of problems associated with diltiazem. So all the dermatitis and kind of points. Verapamil has a rare side effect like gynecomastia, hepatitis, and gingival hyperplasia. So what you have to keep in mind, first of all, when you are learning the calcium channel blockers, all the basic information need to keep in mind, and based upon that you have to understand what kind of effects and side effects, and some of the unique side effects like verapamil has a gynecomastia and gingival hyperplasia, diltiazem has a more kind of dermatitis problems, okay, and dihydropyridines is more kind of like a tachycardia related issues. So you have to understand and make yourself familiar with all the common, infrequent, and rare side effects of the calcium channel blockers. Wow, good. You are doing really good. Now, the comparative information is the hypertension. Main user case of the calcium channel blockers are classified in hypertension, angina, and some unique user case. Okay, so these are the three main points we have to learn. Hypertension, calcium channel blockers are considered as similar like diuretics and beta blockers and SC inhibitors. So this medication is also the most commonly prescribed first line group of medications. Okay. But the diltiazem and verapamil, no proven advantage over diuretics and beta blocker, but that increase the risk of stroke with the diltiazem and increase the risk of MI and heart failure with the verapamil. So when the patient is suffering from hypertension, we should have to use the medications like dihydropyridine group. That means nifedipine, felodipine, those kind of medications, but should not use diltiazem and verapamil for hypertension management. This is the point that you have to understand. Felodipine and a long-acting nifedipine is effective in elderly patients. So there is no any superiority between the felodipine and long-acting nifedipine. ALHAT trial. ALHAT trial is very important trial. That's what's the full form? A means antihypertensive, and lipid lowering medication, antihypertension and lipid lowering medication for heart attack related prevention, heart attack prevention. Okay, so for this trial is showing amlodipine comparable to thiazide, but the amlodipine increase the heart failure risk compared to thiazide. That is very important. Verapamil and diltiazem is contraindicated in heart failure. Okay, combined with beta blocker only with close monitoring. This is very important. When we are giving the verapamil and beta blockers, this combination, okay, you can expect two different questions here. These are the very unique question that you have to understand. When the verapamil and beta blockers, both medications are act on your myocardium and significantly drop down the myocardial contraction. That means that increase the risk of cardiac block. Okay, severe bradycardia. That kind of side effects are associated with this combination. But when some specialist doctors are prescribing in a combinations, but when you are getting or come across this kind of combinations, always you have to be alert about it, and patients should be counseled when you are taking these two medications. You have to keep a close eye on your heartbeats. If you start feeling the very slow heartbeats, immediately you have to contact your doctor. So that is the combination, verapamil with beta blockers. But on the other side, you can expect this kind of question in your exam. The patient is taking dihydropyridine calcium channel blockers. Why doctor has given beta blocker along with it? Why this combination? Okay, so your answer would be nifedipine or dihydropyridine group can cause vasodilation. Due to this vasodilation, that increase the reflection of reflective tachycardia. So, nifedipine induced reflective tachycardia can be controlled by beta blocker. So, nifedipine with beta blockers is considered as a positive combination because nifedipine induced reflective tachycardia can be controlled by giving the beta blocker along with it. So, that is also very important point you have to keep in mind, and you have to make a notes about it. Okay, so combining beta blockers with the diltiazem or verapamil, you have to closely monitor your heartbeats. Amlodipine, felodipine, so not to increase the morbidity in chronic heart failure patients. So hypertension, which medication need to be given? Amlodipine, felodipine, or nifedipine. This kind of medications can be given to the patients. Make sure verapamil and diltiazem should not be given for the hypertension. Angina, symptomatic relief similar to beta blockers. In these situations, not a combination, normally alternative, either beta blocker or calcium channel blockers like verapamil or diltiazem. Special situation, special case, we can combine these two medications. Okay, this is very important to understand. Only control release verapamil so to reduce the cardiovascular event in stable angina patient. Stable angina patient, normally we are giving verapamil in a control release form. Okay, may decrease the reinfarction and death after myocardial infarction. That means the verapamil is considered as a good medication for angina and MI. Okay, other user case, verapamil is prevent and treat what? Supraventricular, SVT, supraventricular tachycardia, ventricular rate control, atrial fibrillation and flutters. That means verapamil is considered for arrhythmia. Why? Because arrhythmia, that is because of the over electric conduction. So verapamil is control the electric conduction, and due to that, the use for the arrhythmia management medication. That is a user case. Okay, nimodipine, that used to prevent and treat ischemic neurological deficit post SAH. Okay, this is the cranial blood vessels ischemic condition is minimized because of this hemorrhagic situation. Already we have explained that part. Nifedipine is used for preterm labor. Okay, preterm labor because of uterus relaxation. So these are the unique user case of these medications. So I think now you are expert in calcium channel blocker related more detailed understanding. Duration of actions, various pharmacokinetics and formulations. Mainly medications are available in conventional and control release form. Okay, so when the control release form, make sure you have to give advice, should not be chewed, or the entire medication need to be swallowed down. Nifedipine and felodipine, short half-life, fast absorption. Nifedipine and felodipine. Control release tablet can be given in once daily formation. Nifedipine and felodipine. Amlodipine and lercanidipine has the longest half-life, slow onset, and once daily. So if you are getting this kind of specific information in your exam, also you should be at the position to handle the calcium channel blocker related questions. Wow, good. What the main practice point that you have to keep in mind? Dihydropyridine induce edema. That means the vasodilation increase the permeability, and that increase the edematous condition. This edema should not be treated with the diuretics. Normally edema is treated with the diuretics because edema is due to the fluid over retention, and that's called the fluid overload. That's a overload of the fluid can be thrown out with the help of diuretics. But this calcium channel blocker induced edema is not controlled or should not use diuretics, otherwise that can cause the volume depletion, and this volume depletion is very dangerous in cardiovascular patients. Okay, so I hope you have understood the entire concept of calcium channel blocker. This like 20, 25, 30 minutes if you are going to spend on the calcium channel blockers, understand all the bits and pieces, all the informations, synthesize your own understandings of the calcium channel blockers, the classifications, chemical classifications, user case, what are the common side effects, what are the key points you have to remember. Okay, and if you are ready with all these things, you are at the position to handle any kind of questions from the calcium channel blockers. Thank you very much for joining today's class, and see you in the next class. Have a great time. Bye bye.